Pneumonectomy is, we know that it's removal of one whole lung. Introduction, this not all people with the lung disease are good candidates for pneumonectomy, and if anyone going to have lung removed, others will be have to pick up the slack, so to speak, and will have to work harder to bring enough oxygen and get rid of carbon dioxide. And mainly the people those are having the poor health status and those who doesn't have the proper lung function usually cannot have a pneumonectomy. Coming to the definition, the pneumonectomy is the removal of the entire lung as a form of open to lesser resection such as lobotomy, segmental resection and wedge resection. So here the lungs are two large organs in the chest cavity, and if you are seeing the job of the lungs is to filter oxygen and put into our blood. And the lungs also it protect us from harmful substances like smoke, pollution, bacteria and viruses. And these trap and partially kill these substances and in mucus that is mainly produced in the lungs. So this type of mucus is removed from the body by coughing and swallowing. Coming to the indications for pneumonectomy, that is bronchogenic carcinoma or lung carcinoma or multiple lung abscess and malignant lesions or any unilateral tuberculosis. And even extensive unilateral bronchiectasis and massive hemoptysis and bronchopleural fistula. Position of the patient. So what the position we will make the patient alive. So usually the orientation of the surgeon is the position because it offers best overall assess of the hilar structure and allows more flexibility in managing the various stages of operation. So commonly we will use prone and supine position. Incision of surgical site. And the standard incision for pneumonectomy is a generous posterior lateral thoracotomy through the fifth intercostal space. Pneumonectomy. Pneumonectomy is, we know that it's removal of one whole lung. There are two types of pneumonectomy, radical pneumonectomy and extrapleural pneumonectomy. So, and even extensive unilateral bronchiectasis and so here what will happen means all hilar and closely adjacent mediastinal lymph nodes are removed with the resected specimens. Extensive dissection of mediastinal lymph nodes will be done routinely. And extrapleural pneumonectomy here usually the surgeon will be removing the entire lung as well as part of the membrane that covers the heart, that is pericardium and part of diaphragm and the membrane which lines the inside of the chest, that is the pleura. And mainly the pneumonectomy is done during the surgery called thoracotomy. So incision cut will be made between two ribs from the front to the chest around to the back. You can see the incision is made from the front to the chest around the back, and this allows the surgeon to remove the lung and anything else that need to be removed. So that is extrapleural pneumonectomy mainly done for the patient those are having tuberculosis, emphysema either with or without bronchopleural fistula, and extensive unilateral parenchymal inflammatory disease and removal of lung with the inverting envelope of parietal and pleural may after give the best chances of disease resolution called as extrapleural pneumonectomy. Final steps in pneumonectomy, that is reinforcement of the bronchial stump and advice in care of radiation. Coming to the indications for pneumonectomy, that is bronchogenic carcinoma or lung carcinoma or multiple lung abscess and malignant lesions or any unilateral tuberculosis. And the activities, so usually the recovery from a pneumonectomy will depend on the extent of the procedure we have done, and often a 7 to 10 day hospital stay is required, and after surgery the patient, sometimes some patient may be on ventilator or respirator and have chest tubes that will remove extra fluid, and mainly we will say the patient how to take care of incisions, and we should always give instruction before leaving the hospital. And because the patient may tire more easily, and this is normal because remaining lung and heart have to work harder, and we should insist the patient, if and all he feels tired, ask him to take rest, and the patient may have been told to do exercise to increase the strength and movement in the arms and shoulders, and so commonly for any surgery we will be insist the patient to do exercises, and patient may even can have home physical and occupational therapy. The therapist will teach how to safely do daily activities, movement and exercise. And we should advise the patient should not lift anything that is heavy, and ask the healthcare provider for an exact weight limit, and avoid sit with the legs down or cross the legs for a long time, and when lying down ask the patient to use a few pillows to support the knees and lower legs. And we should also advise the patient to keep the incision site clean and dry, avoid use the creams, lotions or ointments, and avoid any activities that is increasing pain, and avoid smoking and even second-hand smoke, and better often if the patient want to work for the maximum 8 weeks after surgery, he can continue the work, and the patient should not drive in case if they are taking any narcotic medicines, and if the patient feels a palpitation or any increased heart rate, he should inform the doctor. And we can even advise the patient to use incentive spirometer, and you can even explain how to use the incentive spirometer at least a minimum 5 to maximum 10 times, so that it will be expand the lungs. And even we can supply oxygen if and all it needed, and even the patient feels they are having a increase in temperature, that should be notified to the physician, because that may be a sign of infection, and the wound care is important, and the follow-up advisor should be tell to the patient. And if there is any shortness of breath or sweating or swelling in the legs or any abnormal heartbeat or any chest pain, these all the things should be immediately notified to the physician. Thank you.